My question goes like this: are there disadvantages of this family planning medically?
Yes, there are, because nature is just the 100%. Any other thing, from outside nature is not 100%. Injectable tablets, they have a lot of disadvantages, because when you give a woman oral pills to take to prevent becoming pregnant, she has a particular hour of the day to be taking it for as long as she wants to remain on family planning.
So if, okay, for instance, I'm supposed to take my pills by 12, that means every day I should take my pills by 12.
Yes.
So when I miss it, what happens?
Then that is the disadvantage. Once you miss that hour, you have started missing the authenticity of the drug, of which some people even forget to take it a whole day. So when you take it the following day, they will not take two. It does not give the answer, because the vacancy has occurred,
so
and the chances of becoming pregnant is now there. That's about the tablet. Then the injectable is every 3 months. Once the woman takes the injection, the menstrual flow ceases, and she is supposed to take it every 3 months. But she should take it every 3 months for 1 year, which is 4 times in a year. She will not become pregnant, but eventually, assuming she wants to become pregnant next year and stops
taking
the injection this year, she cannot become pregnant even next year, because the body will still be responding to the action of that injection for the next 2 years. So until the injection goes out of her system, she will not take it. That is one of the disadvantages of injectables. And of recent, injectables causes more harm to the body than other ones. That is why it is advised, any woman that wants to be taking injection, it's advised not to take it more than 2 times.
You know, you talked about the 10 years family planning, which will be inserted through the vagina. Do you, okay, when it is inserted through the vagina, what does it do there? How does it work?
Okay, now the loop, it is called copper T. When it is inserted into the vagina, it is there to disrupt any fertilized ovum, because it does not stop fertilization. When man and wife have coital relationship, the sperm will conjoin with the egg and form a baby. Now there is a place in the uterus where the baby travels from outside the tube, the fallopian tube, into the uterus to perch. Now when it perches, it grows there. The copper T, as it is called, is placed in that place, in that area, in the top part of the uterus where the perching takes place. In that case, when it now travels into the uterus to perch, the copper T will not allow it to perch. It will now disrupt it. Disadvantage: the copper T, with heavy bleeding during menstrual flow, with some men playing with their wife by fingering, can draw the loop down. This makes it possible for some people to be on the loop yet become pregnant, making the child to come out with the loop in his or her hand, because the thing was drawn out of the position, and when the baby came, it stood there and grew. Hence, that is the disadvantage of the copper T.
So we've all heard it from the nurse that abstinence is the best form of family planning, because naturally everything that has advantage also has its disadvantage. Thank you.